It is is it the third Friday? Third Friday. No, yes, third Friday, which means it's Adventist Health Day. And I have Brandi Harris and Twyla Plummer here from Adventist Health. Good morning.
Good morning.
Hello. Introduce yourselves and tell us what you do at the hospital.
Thank
or
you.
Adventist Health.
My name is Twyla Plummer, and I am the Director of Operations for our outpatient clinics. So we have 9 outpatient clinics that cover the coast up and down. And
Adventist Health as an organization.
Adventist Health Tillamook.
Oh,
yes,
really?
Yes.
Oh, wow.
So under the umbrella of our Critical Care Access Hospital, we have 9 clinics, which is super exciting. And so I oversee those, again, up and down the Oregon coast, but then also over into Estacada and Welch's, Oregon, where our Woodland Clinic is. And then we also help take care of our...
and that's all Adventist Health Tillamook?
That is correct.
Wow, that's crazy. I didn't know that.
I know. Yes, super exciting.
And I talk to Adventist Health literally every month, and like nobody has ever mentioned that because you haven't been here in a while.
I know, I haven't. Well, I am happy to talk all about our clinics and the wonderful services that we provide to our communities and patients. So yeah, super exciting stuff. And then we also help take care of the inmates at the Tillamook County Jail.
Cool.
Yeah.
And Brandi, tell us about yourself.
Yeah. Hi, my name is Brandi-Ann Harris, and I am a family nurse practitioner and a psychiatric mental health nurse practitioner as well. Currently, I'm working in the role of family practice at Adventist Health Tillamook Plaza, and I'll be starting a new role in January, adding 1 day a week as a psychiatric nurse practitioner.
Cool.
Yeah.
And so we're going to be talking about mental health services that the hospital provides or have available, right?
Outpatient clinics.
Yeah.
Yes.
So what do you want to start with?
Ooh.
Because you have a lot of different people and areas that the outpatient clinic covers.
We do, absolutely. So starting in, hopefully by spring of 2024, we're going to have a licensed clinical social worker available for our patients in Hoodland and Estacada. So that's super, super exciting. We haven't had services there for a while, so we're very excited about that.
Oh, that's nice when you can add it back in.
Absolutely. Also, hopefully somewhere January, February range, we're going to have Therese Haddon. She's a licensed clinical social worker that will be spending 20 hours a week helping our inmates out at the jail, kind of getting them with some services. And she really specializes in PTSD with our veterans.
Oh, interesting.
So we're excited to have that opportunity and kind of tap into those needs because we haven't had that for a while.
Can you talk a little bit about the contract that you have with the county for the jail? Because you have a nurse that's there, like a medical nurse that's there on occasion, not there full-time, right?
Actually, we offer full-time medical services for the inmates at the jail. We're contracted to 20 hours a week for physicians. And so twice a week, we do have physicians there, but med staff is there every day. So we have an RN, EMTs that are there taking care of all of the inmates in the jail. So if there's a special need, something that comes up and we don't have a provider on staff, they immediately reach out to our providers to offer services. We'll transport them to the jail. Our staff is very, very skilled to take care of those inmates, so they get the best services possible. It's just as good as if they were in the clinic or in the hospital.
So you'll have, what did you say? You'll have a mental, what did you call her?
We'll have a licensed clinical social worker.
Thank you.
Yep, starting the first of the year for the jail specifically. And then we also we just onboarded Elena Kea Jenkins. She's a psychiatric nurse practitioner, similar to Brandi. Super excited, but she only sees clients virtually. So we just started that up. Really shout out to our IT crew who made that happen for us. She sees clients of all ages and can do med management. Again, very similar services to Brandi, but it's not in person. It's just video. And she's been a great service so far. She's already seeing her schedule's getting booked, and we're excited about that.
I can imagine if folks maybe have some limitations on being able to drive, or maybe their schedule doesn't allow it, that's probably really convenient.
It is. For this service, however, for virtual, they do have to come into the
Oh,
clinic.
it's one of those where you have to,
Yes,
gotcha.
we did during COVID times. We were able to offer
Well, I was going to
services
say,
on a
telehealth pre-COVID really wasn't a thing. Like some places offered it, but it wasn't as widespread as it is now and available. And I think that's a really cool thing that came out of COVID.
Agreed. Absolutely.
I wouldn't say that about a lot of things, but
some
I do think there are some really great things. Yeah, and I think a lot of the virtual meetings that like the legislature has and the commissioners have, there have been some really positive things that came out of COVID.
There have been.
Yeah,
Absolutely.
It was a tough 3 years, but here we are.
And it's better. We do have a couple more providers. We have Adrienne Rumbach-Sieverts. She's also a licensed clinical social worker at the Plaza. And she offers therapy to everyone, children 5 and up, with many years focused on children, teens, and families. And she focuses on utilizing cognitive behavioral therapy with the understanding that it's the base for all other types of therapy. And she's really family-centered, person-centered therapy, working on trauma recovery, reducing anxiety and depression. And she is funny and outgoing, and she's just a joy to be part of our. Yeah, she's great. She's fun to be around. And then many of you already know Chris Kruby. He's been in our community for a number of years, and you might know him with his service dog Quinn. They like to go to the beach, playing disc golf and darts and all that fun stuff when he's not busy working with clients as a certified alcohol and drug counselor 1. I hope I was correct on that. Canine assisted intervention specialist. And then he's also an active member with the Tillamook Suicide Prevention Coalition. He volunteers with Red Cross, which is phenomenal. And he's just really actively helping clients with depression, anxiety, PTSD, treatment and diagnosis of ADHD, and recurring conditions. So he's accepting new patients, as is Adrienne and Elena and Brandy. So lots of great things available.
So you've thrown out a couple different titles. Can you explain to me the difference between a social worker and a nurse? You're a nurse practitioner?
Correct.
Yeah. Can you kind of explain the difference between those positions? And then what did you say you'll be in January?
The psychiatric nurse practitioner.
Yeah.
I'm going to actually give that to Brandy, because I
Brandy,
think
take
that
it
she
away.
can definitely answer that better.
So a licensed social worker is a master's degree, and they do all forms of counseling. So their basis is working with patients usually for an hour during each appointment, usually 90 minutes for the first intake appointment. And they really work with them more on the cognitive behavioral therapy kind of basis, and then they can move into other kinds of therapy. It just really depends on what the patient presents with. So they're the ones who see them like on a weekly basis, every 2 weeks, monthly, and then by the end of their time with them, they've completed the therapy that the goals that they have come up with at their very first appointment.
So how does a social worker, is it just a title difference, or how does a social worker differ from like a family counseling therapist? No. Or same kind of thing?
Right.
Okay.
Right. Pretty much.
Just a different title?
Yeah. There's different states, different titles, different levels of education. Gotcha. There's also like psychologists. There's also like other varying degrees who also offer counseling as well. Like psychiatrists, they do both the role of a counselor and a psychiatric nurse practitioner. So they can both prescribe medication and do counseling because of their extensive training in medical school, residency, and fellowship. So, yeah.
So then how does a nurse, so I think you kind of answered the question about psychiatric, but then a nurse practitioner is what level?
Right. So master's prepared normally. They can be doctoral prepared as well. There's different specialties as a nurse practitioner. So depending on what you go to school for, if you decide to add or change your specialty, it's additional education. So a psychiatric nurse practitioner does more medication management and something called light therapy, LIGHT, like not like therapy as in, the dark months and you buy a box. It's more
the sad
like,
light.
Yeah, right. The sad light. So it's more, or happy light, right? So it's,
I know it's funny. It's called sad.
It is. So it's more of a like lifestyle modifications. Are you doing stuff for yourself? And then adding medication onto it. It's pretty rare to do just medication management and not to add counseling in. So I would say the majority of the patients that I have seen will do medication with me and then counseling with one of the therapists.
Okay. And then, so because you're an LPN now?
I'm a family nurse practitioner.
Okay.
Yeah.
So, but then when you're a psychiatric nurse, did you have to go to extra school for that?
I did.
She did.
I did.
So it's like you went to school and then you worked for a while and then you went and did more school?
Yeah.
One of those?
Yeah. I like school.
Yeah. Oh, good. Well, hey, listen, I think that there's something to be said about lifelong learning.
Absolutely.
It just, keeps challenging and keeps moving you forward. So can you prescribe medication now, or that's what you're going to be able to do starting next month?
Yeah, that's a great question. So as a family nurse practitioner, I do everything that a clinic provider does. So there's 3 different kind of clinic providers, more or less. There's physicians, there's physician assistants, and there's nurse practitioners. And in the clinic, we do the exact same job. Okay.
Gotcha.
As a psychiatric nurse practitioner, so that's what I do now. I see patients for intakes. I see them for physicals. I see them for post-hospital, post-urgent care, all that stuff, right? I prescribe medications. I order labs. I diagnose. I order imaging, all that stuff. As a psychiatric nurse practitioner, I went back to learn more about psychiatry.
Gotcha.
And so I could prescribe the same medications prior to becoming a psychiatric nurse practitioner, but this way I know so much more about what to prescribe. So I'm more of a specialist in that role.
Gotcha.
Whereas a family nurse practitioner or just in family practice, you're more of a generalist.
So I assume your additional schooling had a lot to do with like how the brain and the body reacts to different medications and things like that in relation to mental health.
Yeah, absolutely. Yeah.
I am going to take a quick break real quick. That was redundant. And give away tickets to Santa at the Kiowanda Community Center. So I have the first 2 callers will win a family 4-pack of tickets to the Santa event tomorrow at the Kiowanda Community Center. Call 842-4422. Again, the first 2 callers will win 4 tickets to the fun breakfast event with Santa in South County tomorrow morning. And then I'm going to take a break for my sponsors. The award-winning North Coast Food Trail, a program of Tillamook Coast Visitors Association, celebrates the farmers, fishers, chefs, farmers markets, and food experiences of Oregon's North Coast. From Astoria to Nescoin, you'll find fresh seafood, local produce, locally sourced menus, craft beverages, foraging experiences, and cooking classes. Sunset Magazine called the North Coast Food Trail the best food trip in the West. Find your next delicious meal and download the brochure at northcoastfoodtrail.com. or find videos at youtube.com/Tillamook Coast. Where do you go to find almost anything you need for home improvement? I'll tell you where. Rosenberg's. Rosenberg's has been your local connection for anything you need to build and finish your house to perfection. Carpet, cabinets, paint, electrical, plumbing, nuts and bolts, fencing, windows, doors, and so much more. All those items in one place, but that's only part of the story. What really makes Rosenberg's your stop for home improvement is their people. Their knowledgeable, friendly staff is there to help you through any project. Any question from what paint you should use to how to install a new shower valve, you can get the help you need to do it right the first time. Stop by Rosenberg's today to rediscover what you've known all along. It's better to shop local and work with great people you can see every day. Build it, plumb it, wire it, paint it. Rosenberg Builder Supply, Tillamook. I'm talking with Brandi. I got a hair on my microphone. I keep seeing it. Like every time I talk, I can see like something in my eye, and it's like a little hair that was sticking up. I'm talking with Brandi Harris and Twyla Plummer this morning from Adventist Health Tillamook. So you said there's multiple outpatient facilities along the coast that Adventist Health Tillamook oversees.
Correct.
What are the services provided in those outpatient? Do you have counseling services in some of those locations? Well, you said the one out east will soon.
Yes, Escade and Hoodland will have their LCSW on staff. She's signed and ready to go. We're just waiting for a few more things to kind of fall in place for us. But that's going to be early 2024. And then we are still looking...
Which, by the way, feels like forever.
Right, but
From
it's
now,
like 2 weeks away.
Not. I know.
It's almost there.
Crazy.
So super exciting that it's going to be here before we know it, to have her out there providing services for the community. And then we are still currently looking for an LCSW as well to take care of our clients in our Vernonia clinic, because that's a tough location, to get somebody out there. You got to really love rural life to be out there in that area. So we're still looking for the right candidate.
Hey, listen, they're closer to the city than we are, though.
That is true.
You're not really going over the mountain for that one.
So still kind of looking for that, but we've got phenomenal services here on the coast, and we're just super, super excited for that. So again, still looking for someone as well that can travel to Lincoln City and Pacific City full-time, but Adrienne is actually seeing clients the first 3 Mondays of every month in Pacific City, and then the last Monday of every month, she's in Lincoln City.
Oh, okay.
So we are offering services in those clinics as well. Chris Kruby actually sees clients on Mondays in Manzanita. So we're really just kind of branching out and finding those...
Trying to find coverage where you can.
Trying to help in as many locations as we can. And that's what's great about Brandi as well. She can kind of offset when those providers are in different locations. She's going to have that availability on Tuesdays, which is going to be super, super helpful. And then Elena can see virtually Monday through Friday.
But you have to be in the office to do that.
You have to be, you have to be in the
plaza?
Right now, it's just at the plaza. However, the telecommunication hardware will be available in all of our clinics. And because Elena is virtual, we can have a patient on the schedule at the plaza at 10. We can have one on the schedule at 10:30 in Estacada, and we can just make that work with the magic of technology.
Yeah, that's cool.
Yes.
Telehealth is a pretty cool thing. Doesn't work for everything, if you have a broken arm, telehealth isn't going to help you, but for things like this.
Come see us in urgent care, we can help you out.
Yeah. What else you want to chat about? Were you writing something when I was talking about my ads?
Yes, we wanted to talk about
I saw you writing something.
Thank you. About our MAT program, and Brandi is our champion on that. It's our medication-assisted therapy team, and she can definitely explain this way better than me. Chris is a member of that team, but Brandi, take it away on that. It's really her
take
baby.
It away, Brandi.
Great. So MAT, medication-assisted therapy, is a therapy offered to individuals who would like to get off of illicit drugs. So it's also for people who have alcohol use disorder. But the majority of clients that I see, because I've been seeing patients for this for about 5 or 6 years, which is part of the reason why I chose to go back to get my psychiatric nurse practitioner. So I see a lot of people who are trying to come off of heroin, trying to come off of fentanyl, but also people who are addicted to opioids, such as Percocet, Vicodin,
I was going to ask if prescription drugs were included in that.
Absolutely. So, a decade ago or so, you come into the clinic and, there's multiple prescriptions being written for opioids. And since we kind of hit the opioid crisis, and now we're kind of coming back down from it, and we're thinking, maybe chronic pain management isn't what we need for our patients with chronic pain, not with the opioids being prescribed. And a lot of them were being overprescribed because we didn't know that they shouldn't be overprescribed, right? So now we have patients who have been on high doses of opioids, and now they feel awful being on them because there's so many side effects, but they don't know how to get off of them, right?
Right, because it's a huge withdrawal.
It is a huge withdrawal. So they try to come off of it, or they're so, used and accustomed to them. So they end up, doing things that they wouldn't normally do and probably not using the medications like they're supposed to. So then that's when, more or less, they become part of that criteria for opioid use disorder. So then they'll come and see me, and we'll talk about all their different options. So I'm going to I see several patients for that right now. And so they're also going to be part of my Tuesday panel that I see for my patients. Yeah.
And so what is that? I mean, I assume everybody's journey is going to be different, of course. But what, generally, is there some type of, placebo medication that is used in place of that helps kind of rid their system of whatever's happening, or allow their system to rid of the drugs?
Sure, that's a great question. So it's not a placebo. It's actually a medication that is also an opioid, but it works differently. It's not one that's going to give you that full, pain relieving or some, quote, high, right? It's one that's called a partial agonist. So what it does, it helps them to come down off of it. It kind of binds into different receptors that opioid binds to, but then doesn't give them that, for the most part, doesn't give them that high feeling, right? And that's called Suboxone, which usually has the big active medication is buprenorphine. So that's what is prescribed to these patients for the majority of those patients, heroin, fentanyl, and other prescribed opiates. Yeah.
So it basically blocks the receptors or fills the receptors so that they can't. If they using it, would it give them a high?
No, not necessarily. Not if they use too much while using it, then they can definitely kind of break that threshold. But there's lots of problems with that, right? No, this actually allows them to not go through withdrawal as much, right? And it also decreases their cravings. So there's patients who come to me who have been off of, their drug of choice, for lack of a better term, for a few days, a few months, but they struggle daily with this withdrawal, and having such an addiction is all consuming.
Sure.
Right. And so their whole life
especially
is
if
just
they've been doing
that.
it for a while.
Absolutely. And most of them have come to me, they're just like, we need help, we're not sure how to get off of this, right? And so Suboxone is one of those medications that, as well as methadone, that have been used to help people get off of it. Suboxone's different than methadone is that it is a partial agonist, right? For that opioid receptor, like I had mentioned before.
Gotcha.
So when they come to me and they've already been off of it, then we slowly start on at the lowest dose possible of Suboxone. They see me weekly until they have the confidence to be able to see me every 2 weeks, and so on and so forth.
Gotcha.
So, yeah.
Yeah. I mean, my experience with addiction is watching Intervention on A&E. However, I have seen on that show, I do think it's an important show in the way that, like, I've never had somebody in my life that struggled with an addiction. So to be able to see what people are going through, even though it's a very small window into that life, but watching people try to get off it, I know that can be an enormous barrier because the withdrawal symptoms can be so intense and strong. And if you don't have the willpower to go through it and try to get through that, it's huge.
Right.
Yeah.
Nor the help, right?
Or the help,
there's
yeah.
so much help. Like, there's a lot of prescribed medications and over-the-counter medications that can help with those withdrawal symptoms. This is no longer, okay, with the opioid that we're going to put you into the hospital for a week and have you come down off of this and it's going to be miserable. This is like definitely like an outpatient service that we can offer, as well as for, alcohol use disorder as well. So.
And we're using the MAT program with, workflows and standards of practice in our ER at the hospital, in our urgent care at the plaza, and also with our inmates at the jail. I mean, it's
sure.
Yeah, with the fantastic support of Dr. Halfordy, Kyle at the pharmacy, our pharmacy director. I always say his last name wrong.
Kyle at the pharmacy.
Conahan?
Yeah. Kyle.
Oh, it's Tom Connaughton's. Is it Tom Connaughton's son? Yes, I think it is.
Connaughton. I always want
I'll
to say.
take your word for it. I'm not sure
Yes,
about that
but Kyle at
relation.
the pharmacy.
Yeah.
Most people just know Kyle at the pharmacy. Phenomenal. So there's just Dr. Douglas also at the plaza. Just phenomenal work, and so I can't thank Brandi enough for all of that.
Yeah, definitely. I know Quentin at the jail, one of the nurses at the jail, is phenomenal. There's a lot of great connections in this community. I know the health department as well offers an MAT program, so there's a lot of help out there, and there's a lot of people who need help. So
I looked it up. It's Kyle Connaughton.
Thank you.
His parents used to own Diamond Art Jewelers.
Oh, didn't know that.
I'm pretty sure it's the same family. We are almost out of time. What else did you want to cover? Anything? Did we cover everything?
We did. Just definitely that all of our behavioral health specialists are accepting new patients. Brandi will start seeing patients on Tuesdays from 7 a.m. to 7 p.m. So that kind of before and after work for people.
Oh, sure. Yeah.
Which is really phenomenal. And then also, Chris, Adrian, and then our new providers that are coming on board. Elaine is accepting patients now as well. And you can just call the main number, 503-842-4444, and ask to be connected with the plaza when we get you set up.
Cool.
Yeah.
Anything you want to say?
No, I just, I'm really excited to start seeing this population here, or more so of it. So, like Twyla says, if you have any questions, give us a call. We're happy to navigate this, how to get
Services.
Yeah. And we're, Brandi, congratulations on all your hard work as well.
Thank you.
I know that you worked really, really hard to get that.
Oh, I
you so
imagine.
much.
How much school was that? Like additional?
It was a postmaster's for a year, but I already have a master's and some bachelor's and a doctorate. So
yes,
because of those other degrees,
so you get to add all the initials to the end of your name now.
Yeah, I'm not really about initials. I'm about helping people. So,
but she was studying and working full time, and
I
think she was
imagine
pulling like 60 hours a week, and then also family as well. So
I was gonna say, do you have kids?
I have 3 teenagers.
Oh boy,
and a military husband. So
geez,
we're very busy.
Yes.
I do want to thank Adventist Health and my family and the community for helping me through this. Adventist Health was like just right on helping me through all
support,
this. Financially,
that's a
and
lot.
then also with my schedule and all my patients who some of them, had to be moved a couple of times in order to accommodate my schedule. But I look forward to serving more of our population.
Awesome. Well, congratulations. That is a huge achievement.
Appreciate it. Thank you.
Anything else? We good? Yeah?
No, I think we're good.
Okay.
Yeah,
well,
great.
thanks for coming in this morning.
Welcome.
Thanks so
Thank
much.
you.